Hello, everyone, and thank you for attending our virtual insight trip from Guatemala. My name is Marta Julia Cook, and I am the Communications and Public Relations Specialist at Friendship Bridge. Friendship Bridge is a nonprofit social enterprise, and our mission is to create opportunities to empower Guatemala women to build a better life. This is accomplished by using the tools of microcredit, education, and preventive health services that allow our clients to build resilience and so they can pursue their choosing opportunities. This time we have called our webinar as COVID Support for Women in Guatemala. As you may know, Health for Life provides health education and services to Friendship Bridge clients in partnership with Maya Health Alliance. Cultural sensitive services are provided by mobile clinics that travel to the villages where our clients live. Each clinic is staffed by female nurses who are fluent in the languages that our clients speak. Today we'll showing you the impact of this program by sharing information and how our program has adapted itself to keep supporting our clients, even more important during the crisis of 2020. And also, how this has impact in the rural areas of this country regarding the vaccination, that it's a campaign that's going on throughout the country. So many supporters like you have traveled to Guatemala in the past and meet with our dear clients during insight trips. But due to COVID-19 travel restrictions, so we have built this type of trips to Guatemala so you can travel to the country virtually. We are so happy you could join us today so you can continue and also appreciate your support to our Health for Life campaign that is running this month and will end in September 30th. Now, I would like to introduce you to Dana Hayes, our Friendship Bridges Development Associate of Global Communications and Partnerships. Welcome, Dana.
Hello, everyone, and thank you again for joining us today. As Marta said, and as some of you know, every year during the month of September, we run our fundraising campaign to support our Health for Life program. 2020 was a difficult year, yet we've emerged stronger than ever, and we are innovating in new ways to keep providing health services to our clients. The theme of the webinar today is COVID support for women in Guatemala, but I also want to honor the nurses because of the work they do and for their commitment to maintaining the good health of our clients. For those of you who have not donated to our cause yet, we hope you can support us. Please visit www.friendshipbridge.org and click Donate to Support. Back to you, Marta.
Thank you, Dana. I'm excited for our health campaign this year. With that said, today we have the presence of few people whom I have the great honor to introduce, who will share with us later. First, we have with us Dr. Andrea Garcia from Maya Health Alliance, our partner for the Health for Life program at Friendship Bridge. She will give us general information about how COVID-19 has been behaving in rural communities in Guatemala, what impact the vaccine is having, if people are willing to take the vaccine or not. And also we have with us Scott Chita. He is a community health specialist with a BS in human philosophy from the University of Oregon and a master's in international community health from the University of Oslo. Scott arrived in Guatemala in January of 2020 to work as a research associate for Friendship Bridge's partner, Maya Health Alliance, for 1.5 years, and he conducted research on child malnutrition and diabetes, and also assisting in starting a diabetic clinic. Scott joined Friendship Bridge in June of 2021 and works in 3 different projects, very important for the organization. One is education on COVID-19 and vaccination, also vaccine promotion and registration, evaluation of our Health for Life program. Welcome both to this webinar, and also we have the great honor to have Ermelinda Chowak-Seteng. She is a Friendship Bridge client who we have the honor to meet later. So Ermelinda has received her first vaccine against COVID-19, and she's waiting for her second doses in October. She will tell us about her experience through this process to getting the vaccine, what side effects she has, or if she has some, and also what misinformation she had before taking it. So it's very important for you to know how this is conducted here in Guatemala. So, but before that, start with the interview with our amazing guest today. We also want to share with you a video about how the mobile clinics are conducted on the field, and also meet some of our clients and hear from them, and also see the non-formal education session about COVID-19 through our facilitators and clients. So I'm very excited to take you to Guatemala, rural Guatemala, and also you have the experience how our mobile clinics work or how our health program works. So let's go into the rural Guatemala.
Puente de Amistad es una organización social sin fines de lucro y nuestra misión es empoderar mujeres guatemaltecas en la construcción de una vida mejor. Puente de Amistad tiene dentro de sus servicios el microcrédito y la educación. Adicionalmente también tenemos nuestro programa de salud, el cual llamamos Salud para la Vida, el cual también combina educación junto con exámenes preventivos. Esto lo hemos logrado gracias a nuestra alianza con Wukukawok. Con la llegada de la pandemia también hemos activado diversas medidas de contención del COVID-19 con nuestras clientas. Una de ellas es que hemos adaptado nuestro programa de salud para la vida de clínicas móviles grupales a clínicas móviles domiciliarias, el cual consiste en que nuestras enfermeras de campo se trasladan hasta la casa de nuestras clientas para brindarles nuestro servicio de salud. Por la parte de nuestro programa de educación, hemos dedicado un módulo exclusivo para hablar sobre la prevención del COVID, el cual contiene temas como medidas de prevención, vacunación y la desmitificación de las creencias sobre el COVID. Durante agosto abordamos justamente el tema de vacunación y nuestro objetivo era promover la vacunación entre nuestras clientas. También hemos puesto a disposición de nuestras clientas una línea telefónica para que ellas puedan optar a nuestro apoyo para registrarse en la página oficial del Ministerio de Salud Pública y Asistencia Social o quieran resolver sus dudas previo a su vacunación. A continuación ustedes verán, número 1, el desarrollo de una clínica móvil y la experiencia de una de nuestras clientas que recibe por primera vez el servicio de salud. También, en otro apartado, podrán observar cómo desarrollamos una educación no formal en campo y el testimonio de una clienta que ya ha decidido vacunarse.
Una clínica móvil consiste en que la enfermera vaya a visitar a una paciente a realizar chequeos de prevención y dar plan educacional a las señoras. Hoy visitamos a dos pacientes, ¿verdad? Brindando los servicios de prevención, que es de peso, talla, toma de la presión arterial, examen de azúcar, ¿verdad? Además de estos servicios, pues se cuenta con Papá Nicolau, pruebas de embarazo, pruebas rápidas, ¿verdad? Y que es opcional que nuestras pacientes elijan, porque no es obligatorio, ¿verdad? Ellas eligen lo que quieren realizar el día de la clínica.
Inge Martio Shefes, se shuchin ocho, se shuchin colbal, en se la conquista. Se sotna que un shulola con ote, tin yo más de penactar, no. Por en quien tienta comer ta ab, quien tienta comer ta ab, en que mayo, con se shula, que pasa, ni kun ni cuando no gastar, no me cash, che ab, che, gracias a Dios, tenía ver chicota, se shuchin ocho, Martio Shefes, ni. Patus ni kenahkan nunca otra institución no me dice que pierde que nadie consulta no yo corta que va primera vez por par cuenta amistad en COVID gracias a Dios si ves espíritus quien cuenta quien también es una consulta por Dios corta que ve
Todo el puente de amistad va ayudando a nuestras clientes, ¿verdad? Sobre la educación no formal, en cómo desarrollar en sus negocios y también cuando empezó la pandemia, de que nosotros estuvimos dándole una educación a nuestras clientas o cómo cuidarse, ¿verdad? Con su salud. Y nosotros ahorita vamos abarcando sobre el tema de la vacuna para que nuestras clientas se animen y tengan la mejor idea para decir, y sí me voy a vacunar. Y como yo les digo a ustedes, esa vacuna
nada más es una defensa. Eso no es decir, yo ya me vacuné, ya me puedo ir a fiestas, ya me puedo ir en diferentes lados donde hay aglomeración, ¿verdad? No, eso no es así, sino que uno se tiene que cuidar todavía. Yo he compartido con diferentes grupos y más que todo yo les he preguntado a mis clientes si ya se vacunaron y más que todo mis clientes dicen de que la vacuna tiene, más que todo es una enfermedad para ellas y no se quieren vacunar. ¿Qué dicen de la vacuna?
De que hay quienes se mueren al ponerse la vacuna y otros dicen de que ya tienen el virus, por eso de que a la hora de vacunarse mueren.
Pone la vacuna, ya solo 3 años va a vivir.
Ya solo 3 años va a vivir, ¿verdad?
Y hay una que va a vacunar, ya no va a tener hijas, así como usted, así como ella no va a tener hijas.
Bueno, entonces eso se estaban diciendo todas las personas, lo dicen, ¿verdad? Dicen, es que si ustedes se van, dicen que ustedes se van a morir en 2 años. ¿Quién les dijo a ellos? Ellos dicen, ¿quién se los dijo? Ellos nada más lo dicen, ¿verdad? Entonces yo les comento, ¿verdad? Una experiencia. Nosotros, toda la agencia ya nos fuimos a vacunar, ¿verdad? Entonces, como les digo, entonces como decían ustedes, de que en 2 años se van a morir, entonces de plano que nos vamos a morir nosotros, ¿verdad? Porque ustedes están diciendo, ¿verdad? Pero eso dice la gente. Entonces, tengo a 3 clientas de que ellas ya se vacunaron y nos tienen las experiencias. Ellas, doña Felipa, doña Manuela y doña Isabel. Ellas son las que ya se vacunaron, entonces ahora no tenemos el porcentaje del alto, ¿verdad? Sino que estamos tratando la manera para que nuestras clientes se animen a vacunarse.
Puente de Amistad nos habla sobre la vacuna y pues yo pienso, ¿verdad? Que sí es importante vacunarse. Yo me vacuné porque fue mi decisión mía y mucha gente dice, señor, que la vacuna no sirve, pero yo ya me fui a vacunar y no me pasó nada.
Para las que no se han vacunado y se quieren vacunar y no saben cómo, ¿verdad? Entonces nosotros los vamos a ayudar. Puente de Amistad los ayuda a registrarse, pero eso es voluntario, ¿verdad? Eso no es obligatorio, eso es voluntario. Pues yo les animo a todas las señoras, ¿verdad? De que ellas se animen a vacunarse, ¿verdad? Más que todo es una defensa para el cuerpo de cada una, ¿verdad? Más que todo esa es la cuestión, no es de decir, ¿verdad? De que les va a pasar algo, sino que esa es una defensa para el cuerpo.
Que van a invitarle Cachlal Shokib y Ople Puente de Amistad que de vacuna la red siempre junto y cola le se cae pero
Yo los invito a cada clienta, ¿verdad?, a que nos pongamos la mano en la conciencia por la pandemia que estamos, ¿verdad?, en vacunarnos, porque es una buena oportunidad que tenemos para protegernos. También debemos de saber que no solo con la vacuna nosotros ya estamos protegidos, sino que debemos de seguir con los protocolos, ¿verdad?, de usar siempre la mascarilla, lavarnos las manos, usar nuestro gel siempre a donde vamos, porque no conocemos con quién podemos estar con alguien y no sabemos si ya está con el virus y no sabemos en qué momento nos puede afectar. Nos puede afectar en varios ámbitos, en lo familiar, en lo económico, entonces tenemos que cuidarnos.
En nombre de todo el staff de Puente de Amistad y en nombre de todas nuestras clientas, queremos agradecer por el apoyo que cada uno de ustedes brinda a nuestro programa de salud para la vida, el cual ha tenido un mayor impacto en tiempo de pandemia. Esperamos contar con su ayuda.
Very inspiring, huh? After watching our clients receiving their medical checkups in their homes, speaking their own language, makes me feel so great to be part of Friendship Bridge. As part of our social responsibilities, Friendship Bridge is also taking actions to motivate our clients to get vaccinated. Now, I would like to introduce you or to have the conversation with Dr. Andrea and Scott. So first, we are going to hear from Dr. Andrea. So she represents our partnership with Maya Health Alliance. Welcome, Doctor, to this webinar, and welcome, Scott. Thanks for giving us your time today, and and share with us. First, Doctor, we want to hear from you. Can you tell us a little bit about yourself, who you are, and the work you do? Welcome.
Thank you. I am very happy to be here with you today and sharing our experience from Ukukawok Maya Health Alliance. So my name is Andrea Garcia. I am a medical doctor. I have been working with Maya Health Alliance for the past 4 years. And I am very proud of the work we do in community health, preventative health with the Friendship Bridge clients.
Thank you very much. So, from your experience in recent months, how important do you consider people in rural communities of this country place COVID-19 currently, and why?
Well, unfortunately, the information available is very scarce. There is not that much information available in their native languages, so there is room for misinformation, misguided information, and therefore um, there is a lot of fear in the communities about what happens with COVID-19, the consequences of COVID-19 for them and their families. So there is a sense of like downplaying a little bit. So if someone gets sick, it's not COVID-19. The vaccine, they don't need it because there is no COVID in their communities. And even if people have heard of the sickness and people getting sick in communities because of the consequences and everything that comes afterwards, there's a lot of fear. That's the sense that we get in the field, that there's a lot of fear around the diagnosis of COVID-19 and now of the vaccine.
Thank you. Yeah, misinformation sometimes doesn't help.
Exactly, yes.
Thank you. So our next question is, do people have, from your point of view, do people have enough information about vaccination, and how do they can register themselves?
Yes, well, the information, like I said, has come from different sources, mostly social media, which is not always the best place to get this type of information. So I think the work the facilitators are doing in the field, giving them information in their languages, has been very valuable to the communities that they visit because often that might be the only source of information. So I believe that taking the message, talking about the vaccine, being able to answer their questions in their own language is really something that needs to be replicated around the whole country because like I said before, we don't have very many sources of reliable information, and that leaves room for a lot of myths, a lot of information that may not be true, and this is what rural communities are basing. That's what they base their decision making on.
Yes, thank you. So our next question is, why are there some people that refuse to take the vaccine, and what are some of those misinformation they have? As you told before, they have heard a lot of information out there. Many of them are not true. So what of those you have heard that people refuse of taking the vaccine?
Yes. So I think like I said before, the fear is really the common denominator in at the beginning, COVID-19, the infection of the disease, and then now with the vaccine, there's a lot of people that don't have the information. So fear is what drives their decision making. And having said that, everything they hear because they don't have the proper information becomes true in their in becomes true for them. So there's a lot of they think that the vaccine gives them COVID-19. That's one that I've heard a lot. So they think that when they get the vaccine, they will get sick, and that will make them get sick and probably die. And because they're not fully aware of how the vaccine works, they think like they are injecting COVID-19 into them. And then other people believe that the vaccine will completely make them immune. So they're not in I'm sorry, I lost my words. So they believe that once they get the vaccine, they won't get sick. So once they get the first dose, for example, they don't use their face coverings. They might not wash their hands as often. So these things make them more exposed to COVID-19 after the first vaccine, and then a lot of people get sick because of this. And so then this information kind of like feeds itself. So that he got sick and he died, but he got the vaccine. So So all this confusion, there really isn't a reliable source to set everything straight and try to give them the proper information. And I believe that this is something that I've seen a lot in the communities where there's a lot of deaths in the community, not necessarily explained why they've died. So the first thing they think of, oh, he got the vaccine. It was probably the vaccine. So infertility is another one. There's a lot of fear about women and men not being able to have children. Pregnant women has been really, really tough to have them get the vaccine because they are really afraid. And initially, the public health care system did not include them in the vaccination groups. So they didn't think they were eligible or it was safe for them to get it. So now that they are, it's been kind of tough work to try to get them the information they need to take their decision.
Thank you very much. Yeah, I have heard a lot of those questions while, we're just being in the field and talking to the facilitators, and we clarify this question. That's why also Friendship Beach has this like open telephone line so they can call and, get the right information they need so they can get motivated and get the vaccines. Or some people doesn't take like 2 doses, they just do one, and after the reaction they say, maybe not to the next one, but we still encourage them to continue the process and close that cycle. So, thank you. So, our next question is the vaccine available for everybody in the country? Because many people ask that, maybe from our audience as well. So, can you tell us a little bit about that, if we have enough vaccine for everybody in this country?
Yes, well, I think it started really slow and it was really hard to get access to vaccines. So now there's a little bit more access in the rural communities. I can say maybe only in like the central, como cabecera, I'm not sure how to say, like the central city,
downtown.
like downtown of the communities. So there's still plenty of area to cover from rural communities to these downtown health posts. So it's still hard to access for many women in rural communities where access to any vehicle or source of transportation is still really hard. So there isn't any efforts of taking the vaccines to these populations. It's theoretically available for everyone, so everyone could go and get the vaccine. But as I said before, the access may not be as easy, and there aren't any efforts to take them. So I think that.
Yeah,
That's what's
especially for
happening.
the registration process, like you need some internet to go online and register yourself. So sometimes it's difficult. So Friendship Bridge is also, as we saw in the video, is taking action to cover that part. And Scott will tell us a little bit about that later. But it's also one of the actions that Friendship Bridge is taking. So our last question, Doctor, is about what action has Maya Health Alliance taken to educate people to get vaccinated?
So language and culture are two things that we try to focus our interventions on. And when COVID-19 came, I think the priority was to take reliable information to people who did not speak Spanish or Spanish was not their first language. And I think the effort to make information available in their languages is something that's important because we know it comes from a reliable source. We have also partnered with radio stations and communities to be able to speak with people from the communities in their language, being able to tackle and answer the most commonly asked questions or the fears that they have around the COVID-19 pandemic and also the vaccine. So I think being able to take this information to them that is much needed has been one of our priorities.
Thank you very much. And we hope to have more time, so we can answer some questions. Thank you. And then next we have with us Scott. Thanks for being here today again. And we have some questions for you. First, we want to know about you, who you are, and a little bit about yourself, please.
Thank you, Marta. My name is Scott Cheetah, and I'm originally from Napa, California. I've been in Guatemala for almost 2 years, originally working as a research associate at My Health Alliance. And I'm really interested in like social inequalities and health inequalities and trying to like bridge these gaps. And so I think the work that Friendship Bridge is doing right now with all the vaccine work is very aligned with this. You can look at vaccination rates in the cities and it can be really high, it's up to like 40 or 50%. While in many municipalities, it's almost, as low as 2%. So I think this work is very important and I'm really happy to be here. Thank you.
Thank you, Scott. So we have this question. We know that we said before you are working in 3 different projects for Friendship Bridge. Can you tell us a little bit about each project you're managing right now?
Yeah. So the first project that I've been working on with Andrea as well is about educating our clients about COVID and the vaccine. And so for 3 months, we've given education, one about COVID, just the sickness, how it works, how to protect yourself, what you should do if you get sick. The second month was about the vaccine, how vaccines work, how they're developed, are they safe, why you should get the vaccine. And then the third, which is the education is going on this month, is about COVID myths and disinformation. So we are trying to dispel the really common myths that we see in Guatemala and also trying to provide some guidance to our clients about how they can find high quality information and how they can avoid bad information. So we give a lot of advice like, if you want to go get your car fixed, you go to a mechanic. If you want to get advice about health topics, you go to a nurse or a doctor, and giving some advice about how to avoid social media as well. And then the second project I've been working on is about helping our clients register for the vaccine, and that is including promotion. So we set up a system where the clients can sign up with us, and we will do the online registration for them because many clients face a lot of structural barriers to registering for the vaccine online, whether they don't speak Spanish or they don't have data on a smartphone. And so we're trying to facilitate that process. We've also been, we set up a health line so that if our clients have any questions about the vaccine, they can call and speak to a nurse from Wukukawak to resolve their doubts. We've been handing out like buttons and bracelets to clients that are already vaccinated. What else? We've been doing a lot lately. The mobile clinics? Oh, but still on the promotion topic, we're starting a raffle next month. So any group bank that has all of the women vaccinated will be eligible to get a prize. And we've also filmed a lot of video testimonials from clients that have been vaccinated and nurses that have been vaccinated, talking about how the vaccination process was and their experience with it. And then the third project is evaluating the Health for Life program. So before the pandemic, the Health for Life program was the nurses would go to all of the bank meetings and then they would do the promotion there, and then they would set up a little clinic in the house of the client where the meeting was, and then the patients or the clients would take turns going into the house and doing their checkup. Because when the pandemic started, it switched to an at-home model where the nurses go to each client's house and do the clinic. And there's obviously pros and cons to both, and so Puente de Amistad wanted to do an evaluation so they could make an evidence-informed decision about which model they should use going forward. So those are my 3 projects I have been working on since June.
Thank you, Scott. That's a big difference for us. Also to have this information, as you said, to make final decision was the best way to keep supporting our clients. So from your point of view, how these type of projects will help the organization?
Well, I think, these projects are really important to the organization because Puente de Amistad is very involved and cares a lot about its clients and about the empowerment of women and the financial development of their clients. And it's very hard to empower people and to help people financially if people are sick, if their family's dying, if they can't get out of bed, if they're in the hospital. So I think, health is a very critical aspect of productivity and being able to thrive as a person. So I think, this is a very basic level that shows that Puente de Amistad really cares about its clients and they want to make sure that they're able to thrive and, live a successful, productive life.
Thank you. Our last question is, what results do you have so far? Have we helped some clients to register already, after the promotion we have started? So
we've been helping clients register. It's the our service of registration has gone a little slow, but I think partly that's due to really the heterogeneity of how the vaccine is being distributed. Should I just wait? So I think part of that is just kind of the distribution and the allocation of the vaccine has been really heterogeneous throughout the country. In the beginning, we kind of thought that everyone would have to register online, and we've kind of found out now that every health center is kind of managing their vaccine allotment in their own way. But I think the promotion work and the education work we've done has been really, really helpful. So every month, so this is the third month we've been doing the education, and every month I go out and I look at the visits and I just talk to clients and I talk to our facilitators that are giving the education, and I see, what their reception is, what kind of questions they have, maybe some things that we should address in the future. And in the first month, every meeting I went to, almost no one wanted to get vaccinated. The vaccine hesitancy was really high. And then last month, it was a little better. Maybe like one or two people wanted to. And then this last month, I was out in San Juan, Zacatepeques, and también Tony Capan. And there, the reception was much, much higher. More than 50% of every group wanted to get vaccinated or already had been vaccinated. And the facilitators I talked to said, yeah, it's definitely, every month it's getting a little better. And so, I think the education is really working well, and the other things that we're rolling out, like the video testimonials, I think that'll only continue to help the situation, and just trying to slowly, step by step, show people that, hey, the vaccine is really good for us. It's good for you. It's good for your family. It's good for your community.
Thank you, Scott. Thank you very much for being here today. And this is so important, as always say, the heart of Friendship Bridge is education, and it's completely doing a huge difference today in the vaccination process against COVID. So it's very important. And now we have with us the honor to introduce Ermelinda Chowaxeteng. Bienvenida, doña Ermelinda. Welcome to our webinar. Ermelinda is a Friendship Bridge client, and she will tell us about the vaccination process and her experience. So as Scott said before, it's having other clients' testimony, it helps to motivate other clients to get vaccinated. We have some questions for Ermelinda. First, we're gonna hear about herself, or what her family look like, how many children she has, or the type of business she manages. Bienvenida, doña Ermelinda. Bienvenida a Puente de Amistad. Tenemos algunas preguntas, es un honor para nosotros tenerla acá. Primero tenemos algunas preguntitas. El primero es contarnos un poco de usted, su nombre, de dónde es, cuántos miembros son de su familia, qué tipo de negocio tiene. Bienvenida nuevamente.
Yo soy originaria de Panajachel y vivo en el barrio norte. Mi familia se compone de 8, pero ya solo 2 pequeños tengo nada más. Y mi negocio es destazar pollo.
Está bien, muchas gracias. She's Ermelinda. She's from Panajachel up to the Barrio Norte, and she has 8 children total, but only 2 are littles and live with her. And her business is to sell chicken meat. Gracias, doña Ermelinda. Tenemos otra pregunta. Our next question is, how long ago have you joined Friendship Bridge and why you decided to join? Nuestra siguiente pregunta es, ¿hace cuánto tiempo usted ingresó a Puente de Amistad y qué la motivó a unirse a Puente de Amistad?
Yo hace como 13 años estoy en Puente de Amistad. Y el motivo fue que poner mi negocio, por eso he estado aquí en Puente, pero me ha servido con mucha ayuda y me ha dejado mucho beneficio también.
I joined Friendship Bridge 13 years ago because I wanted to start a business. Since then, Friendship Bridge has provided me with so many benefits. Nuestra siguiente pregunta, our next question is, what we heard that you've been vaccinated already, so congratulations. Tell us about your experience, how you decided to get vaccinated, how you find the vaccination process. Nuestra siguiente pregunta, doña Hermelinda, es pues sabemos que usted ya se vacunó la primera dosis. Felicitaciones por eso, por tomar esa decisión. Y cuéntenos un poquito cómo fue su experiencia, por qué se vacunó o cómo encontró la manera de vacunarse.
El motivo que me vacuné por cuidar a mi familia. En primer lugar, porque tengo en la casa a adultos mayores y ellos también ya se vacunaron. Todo de mi familia, todos estamos con la primera dosis. Yo les dije, vamos a vacunarnos para protegernos del COVID, para que así vamos a estar bien en nuestra familia.
I decided to get vaccinated because of my family, and also I have older people in my family. That's why I want to protect myself and protect them. I encourage everybody to get vaccinated. So in my family, everybody has the first doses already. So I'm very excited that I could also help to everybody to get vaccinated. Gracias, doña Hermelinda, y felicitaciones nuevamente. Pues, ¿qué la motivó a usted a vacunarse o qué había escuchado allá afuera? Porque sabemos que actualmente hay mucha desinformación, que la gente dice eso, que la gente dice lo otro. Entonces, ¿qué la motivó a usted para decir sí me voy a vacunar?
Pues nada más para estar seguros de no contagiarnos. En primero, y el segundo es de que, bueno, ha llegado mucha información con nosotros, pero como dicen mucho, aunque seamos tan ignorantes, pero ya ahorita con los teléfonos y todo eso, ahí se va informando uno, por medio de internet, uno puede ver y asesorarse un poco.
I get motivated because I wanted to protect my family and also to protect myself, not to get this virus. And we know that also there's a lot of information out there, but even though we have to use like good information to our own education, so internet helps also to give us some information to see how the vaccines help us. That's why I get motivated and get vaccinated. También, doña Hermelinda, sabemos que Puente de Amistad hace diferentes acciones, ¿verdad? Para promover esto entre sus clientes, ¿verdad? Para que se vacunen. En el mes de agosto nuestras capacitaciones fueron sobre la vacunación. ¿Eso también usted piensa que ayuda a que las demás personas se vacunen?
Sí.
How do you feel about the non-formal education about vaccination?
Sí, nos han dado pláticas, las asesoras que han llegado a la casa nos han dado al grupo, especialmente nos han dado una plática sobre la vacuna, pero como nuestras compañeras ya también se acercaron a vacunarse, tienen la primera dosis también.
Yes, Friendship Bridge has talked to us about vaccination, and all the information they provide help that my Trust Brand group have vaccinated already. All the clients within my group have been vaccinated. So our next question is, what information are you hearing in your community that you know may not be true? Nuestra siguiente pregunta es sobre qué es lo que usted ha escuchado que hablan de la vacuna, ¿verdad? Lo que usted piensa que no es cierto.
Lo que he escuchado de la vacuna dicen que trae un chip, pero no sé, eso en realidad es mentiras, porque no trae nada, la vacuna es nada más para protección para nuestros cuerpos.
So she also heard that in her community, people talk about that vaccination brings like a SIM card or a chip in your body that controls you, but she says it is not true. So I did it, so there is no problem with that. So it's not true that people talk about this. So our next question is, would you encourage other people to take the vaccine? Nuestra siguiente pregunta, doña Hermelinda, es, ¿usted animaría a otras mujeres para que se vacunen?
Así es, que todas las mujeres nos vacunemos para poder proteger a toda nuestra familia y a nuestra gente, nuestros vecinos también.
Yes, I totally encourage everybody to get vaccinated, so to protect ourselves first, to protect our family and everybody around us. ¿Algo más que usted desea agregar respecto a la vacuna, doña Hermelinda?
Nada más, solamente.
That's all regarding the vaccination. Our last question for her is, what are some of the challenges or the most important challenge you faced last year and how you did overcome this challenge? Nuestra siguiente pregunta y nuestra última pregunta es sobre cuál fue el desafío más grande que usted recibió el año pasado y cómo usted lo superó para seguir adelante.
Pues todo ha sido normal para mí y siempre he salido adelante. Bueno, primeramente ponemos a Dios y después hacer las cosas para que podamos estar bien. Y gracias a Dios no nos desamparó en toda la enfermedad.
Everything seems like normal to me, so I could manage my business, and thank God I'm continuing with my business these days, so thank you very much for the opportunity. Gracias, Doña Ermelinda. Thank you very much to all the audience we have today. Thank you, Doctor. We still have some time for questions if anybody from the audience want to hear either from Dr. Andrea or from Ermelinda, so we're here for some questions if we have some. Dana or
have one question. Melinda, were you able to keep selling your chicken throughout COVID?
Thank you. Doña Ermelinda, tenemos una pregunta para usted. Dice nuestra audiencia, ¿usted pudo seguir vendiendo la carne de pollo durante el COVID, durante el año pasado?
Sí, así es, porque yo ya tengo clientes especialmente para vender. Entonces no bajé, sino estuve al margen.
Yes, since I have clients who always buy from me, so my business was kind of in balance, so I tried to balance my business. But yes, I was able to do my business during the crisis of last year. Do we have any other question? I have one for Dr. Andrea. Maybe our staff or our audience wants to know. I hear that the Ministry of Public Health is the only one, legally, that can give the vaccine to the rest of the people in the country. Is that true, or there is any other company that can give the vaccine?
Okay, yes. So the Ministry of Health is the main source of the vaccine to the Guatemalan citizens. Also, we have Social Security, which is like a benefit given to workers in many jobs. So it's like a health insurance, semi-public, semi-private. And so they also have the vaccine as well. So they are giving the vaccine as of a few months ago to everyone who has Social Security.
Thank you. Thank you very much. So we are also, how many, do we have any registrations at the moment? Okay, so we have a question here, says if we have tourism open here in this country, if that helps, with our clients' income. I will say, yeah, can answer to that question. We have some tourism is open in Guatemala, and if you have been in Antigua, or if you remember Antigua or Panajachel or Chichicastenango, which are very touristy, it's open. Still, have you seen like that, something like that, Doctor?
Yes, I have noticed more tourism, especially here in Panajachel. During last year, it was silent. A lot of businesses closed or had no clients. And now I see a lot more businesses open, more tourists. So I believe it is picking up again.
Yes, thank you. Okay. So we have another question here, people who have died in the communities, and also if children are back in school. I can answer to the children's school, but about, the complication, the communities, probably Dr. Andrea will help with that. Yes, children are taking online classes. It's been difficult, not only for the children, but also for the parents, to it's increase their expenses when they have to have some internet at home. In other areas, they what they are doing is like every week, like at the end of the week, the teacher and the parents get together and they receive the homework and go home and give that to the children. So week week after they get again together and they just deliver the homework. That's how they manage also in areas where they have no internet access. But it's been difficult also for parents to help the children with education since they have no teaching background. So regarding like how many people have died in the communities, or it's increasing, or it's how's that going, doctor? If you can help with that question.
Sure. So my perception has been like when I first started our conversation, we were talking about fear, and there is a lot of fear in the communities. And this has led to not being open about the diagnosis of COVID or why a family member died. So if there's a lot of sub-registration, like it doesn't really come to to statistics, the deaths that are happening in rural Guatemala, because not all of them are being spoken about or reported. So there is a lot of deaths. A lot of communities are going about their normal ways, their traditions, get-togethers, and this has definitely impacted on the amount of cases. I don't know if maybe Ermelinda could tell us if she knows someone who in her community or something, but the perception that I have is that there are many deaths that are not spoken about.
Aquí están preguntando sobre las muertes en nuestras comunidades, doña Ermelinda. ¿Cómo ha visto usted esto en su comunidad? ¿Cree que hay más gente que está muriendo o la gente ya le toma más seriedad en el tema del COVID para protegerse, verdad?
Bueno, aquí he escuchado mucho de que sí han muerto gente, pero los del centro de salud y la municipalidad lo confunden con fiebre o con un malestar de pulmones. Entonces lo confunden mucho y ellos dicen que es COVID y los doctores dicen que no, que es de los pulmones, que es una fiebre normal, pero el centro de salud dice que es COVID. Entonces no estamos entendiendo qué es lo que está pasando en realidad.
Yeah, Ermelinda says that she has seen many people dying in her community, but what happens is like they don't have like very clear information about if whether it's COVID or not COVID. The health center says it is, and the city hall probably also say no, and they say it's a normal fever. They have normal fever. It's not a big deal, but at the end it's COVID, so it's complicated to understand exactly what's going on or like the reaction. As we know, also COVID has behaving differently, have different reactions. So she says in her community they don't have like clear information and what's going on and what's COVID, it's what not COVID. And also we have another question here from the audience, how the partnership between Maya Health Alliance and Friendship Bridge help our clients avoid COVID-19.
So I think Scott spoke a little to this before, that there is a health line, there's a phone number that clients can call and they will get communicated with a nurse. So if there are clients in the communities that are having doubts about the vaccine, that they got the vaccine, maybe they had a secondary effect or whatever, doubts that come up, they are facilitated with this number, so they can get in contact with one of our nurses, and we're able to help in that way.
Yeah, thank you. And also I've seen, since we went to the interview with Jenny, the nurse, she give her normal like medical checkup to our clients and then take the opportunity to talk about COVID, with the family. That helps a lot. And also I think the language barrier, it's so important to have for them. They trust on Friendship Bridge, they trust on the nurses, and they speak the language. They are from the area, so that's make a big difference, that to go into a health center where they speak no cachiquel or no quiche, only Spanish. So that's make them feel like afraid to take the vaccine. And also we clarified about the side effects. Like some people can have fever and somehow like body pain or so, but not gonna be in everybody's body, it's gonna be different in each body, and also what medicine they can take after they take the vaccine. So that helps a lot. So what do you think?
No, yes, I agree. It does help, and you said it very well. How the language helps to make the clients a little bit more or feel a little bit more secure, and be a little bit more open to state their questions and what worries they have about the vaccine. So I think that definitely helps. We were very careful um, to make this role for the health line so that everyone knows what language each nurse speaks. So if the client only speaks Sutujil or Quiche, there is something very well documented where they know which nurse to call that day in case the patient or the client speaks a certain language. So I think we with Friendship Bridge we have been really careful to respect each patient's language.
Thank you. And also, I want to add to that that Friendship Bridge this year also launched their call center, which is really a big hit for us because our clients call directly to a phone line and we can direct their question to or connect to one of the nurses, so which is really important. So they are feel supported. So with this today, we will have just a really nice event. Thank you for being here today. And with this webinar, we hope you'll understand or learn a little bit more or have more information about how COVID-19 is affecting Guatemala and our clients. But also, I see how empowered they are to look forward. And also, as Scott said, with the information we provide, they help with the registration process, helps a lot, to have a big number of clients being vaccinated. So thank you again, everybody. And please consider making a gift to ensure that our Health for Life program continues and to support many women in Guatemala and have like a big impact in all the thousands of women we support. If you already make your donation, thank you very much. If not, just consider of doing it so you can go also online or call our office. And I think in the chat room also we have the link to the fundraising page that we're using. So thank you very much for being here. Thank you, doctor. It's very informative, all the information you give. Scott, doña Ermelinda, muchas gracias por estar aquí.